too, right?
Yeah, I just want to make sure it's running. Okay. So we just want you to talk to you about how, number one, the Huddle Board engages you as a resident in performance improvement, like scores, if you're competitive, we'd like to hear that. And just what's the difference between the VA and outside, talk about team-based care.
Am I starting?
Yes.
Okay. And I'm speaking to the camera, or am I speaking to these guys?
You can speak to camera and those guys.
To the camera is
Okay.
fine,
Very
because
informal.
You're speaking
Okay.
to Kathy, actually.
I got you. So the one very nice thing about this is that all of us as a team get together and we can talk about the needs of the patient for the day. And as we kind of go through the individual needs that are unique to that visit, I can hear from kind of higher level, big picture things, what they need, all the way down to, do they need a vaccination? Do they need lab draws today? What's going on? So it's very helpful. A lot of checks and balances so people aren't missing things on an ongoing basis. And that's a little different than other systems, because sometimes when it all falls on yourself, you don't have time to see every single checkbox and get everything done. So having a team-based approach really allows us to look at what they need from a pharmacy standpoint, a rehab standpoint, medication standpoint, from ancillary services and consults, and psychiatric care, all of those things.
But can you talk a little bit about your experience here in terms of being outside the VA and communicating with your team here? You know, how you follow up on lab works, on various tests. What happens if you're in ICU and you're not here for 4 weeks?
Yeah, so it's definitely a lot, honestly, it runs better than kind of back at my other institution. So things that are different about being here, at least, the labs come back to not only myself, but it's kind of the entire team is able to access those results. So if I'm away remotely, I can either flag it or have a letter that someone else can send out, or Dr. Orlov will be able to see it. Someone on the team is always alerted. The team can contact me directly or contact Dr. Orlov, so things aren't being missed, even if I'm not here for a prolonged period of time, which is definitely very good for patient care. It's not reliant on one person, it's reliant on the system, so there's multiple levels of redundancy, so things aren't being missed.
Do you see your data every day or whenever you're here? Does that impact how you think about things you do?
Yeah, so I mean, there are definitely certain things that we do for a large number of patients, like counseling for smoking cessation and diabetes management and cancer screenings, things of that nature. When you start to see the numbers, you start to think of why maybe you have deficiencies in some areas. Sometimes there are logical reasons that the point of a visit was urgent care and that you didn't have the time to go into other things, but sometimes you start to realize that maybe you're missing out on a specific demographic, or maybe you have to make a conscious effort to do lung cancer screening on every patient.
Okay. And have you ever encountered clinical reminders before you came to the VA? And, you know, if not, or if yes, like how does it change the way you approach documentation?
Yeah, so I did have some clinical reminders before, and I think that the difference here at least is that you build it into a system of every single appointment you're going to be looking through those reminders, and knowing that you're looking through those clinical reminders means that you aren't going to miss anything. Whereas other systems, sometimes you have to go into a specific part of the chart, or you have to go looking for them to be prompted. So it definitely improves overall the care that you can deliver. It's a very easy part of the job. At the end of every contact with a patient, you just do it.
Okay. I had one more question. Does your team-based care, the way you approach the care of all your patients, do you identify any opportunities for improvement work, or have you done that since you've been here?
In terms of
any opportunities that you or anything that you might see that might make you think, oh, this is some type of improvement would make this better, or
right.
Discussions at your daily meetings
Yeah.
at noontime, 1:00, even those meetings that you have is a great opportunity for you to bring in that information. They all meet as a team before they break out into their specific PAC teams, and that's where a lot of work gets done as well.
I think one of the things that I guess that I've come to realize is with the team-based model, the best thing about it is if I need someone to be seen in short follow-up, it's really helpful because I can have them see a pharmacist or have them see nutrition or same day for mental health services, and those are different things that aren't always available everywhere. So kind of that same day or short-term follow-up availability is important, and we have that in most of our clinics, and I think that just continuing to make that available for more and more subspecialties actually offloads the ED a little bit and also allows us to provide better care, keep patients out of the hospital. So that's the only thing that I would say.
Are you going to be pursuing a track of primary care? Is that?
No, I'm going to be doing hospitalist medicine next year, and then eventually I'll be doing an oncology fellowship.
Okay. And so eventually that's where you want to
That's
go?
the plan.
Okay. All right. I was trying to get you to say the VA convinced you to become right.
No, that's gonna be very, very.
Not many go to
patient.
primary care.
Yeah.
Sure.
Thanks.
So thank you so much.